Important. Cancer in seniors is a national crisis in the United States, and across the United Kingdom, Canada, and Australia, it's terrifying how fast it's spreading. But there's one specific vitamin that is proving again and again to have a massive impact on prevention. This vitamin isn't hyped by the pharmaceutical industry, and it's ignored by most US healthcare systems. Every senior in the United States deserves to know that once you pass 60, your risk of cancer skyrockets not just because of age, but because of inflammation, immune system fatigue, and years of cellular damage. And most people have no clue that one cheap natural nutrient could be a literal barrier against cancer growth. We're talking about vitamin D, the single most studied and potentially most powerful cancer prevention nutrient for seniors in all 4 countries, especially in the United States where deficiency is epidemic. Seniors in sunny states like Florida or Arizona often still don't get enough vitamin D because aging skin loses its ability to synthesize vitamin D from sunlight. On top of that, seniors are told to avoid the sun due to skin cancer risk, but this ends up leaving them vulnerable to far more dangerous cancers like colorectal, breast, prostate, and pancreatic. Researchers at Harvard University found that people with higher blood levels of vitamin D had up to a 60% lower risk of developing colorectal cancer. That is massive. Think about that, just from having enough of this vitamin in your system. But most seniors in the United States are deficient. They aren't slightly low, they're dangerously low. And the US healthcare system often ignores this unless your blood level is shockingly low. The problem is that what is considered normal in standard labs is often just the average of an already sick population. Many integrative doctors in the United States and Canada say that you need to have levels above 50 ng/mL for true cancer protection. Most US seniors are walking around with 20 or less. This is tragic, it's frustrating, and it's unnecessary. A senior in Texas, age 73, had been battling recurring polyps for over a decade, colonoscopies every 2 years, endless fear. She began supplementing with vitamin D3, 5,000 IU per day, and raised her levels from 22 to 55 within 6 months. Her doctor was shocked at her next screening. No polyps. Her immune profile improved. Her inflammation markers dropped. Now, this isn't a miracle story. It's biology. Vitamin D receptors are found in nearly every cell in the body, including immune cells, and it helps regulate cell growth and death, which is exactly how cancer is prevented. Cancer is uncontrolled cell growth. Vitamin D helps your body decide when a cell needs to be killed. That's called apoptosis, and without enough vitamin D, apoptosis can't happen efficiently. This is why seniors in the United Kingdom are being encouraged in certain NHS trusts to get blood tests for vitamin D annually. Canada has even begun publishing guidelines suggesting vitamin D could have protective roles against cancers and autoimmune disorders. Australia, with its extreme sunlight, ironically has very high rates of deficiency among the elderly due to aggressive sunblock campaigns. The entire Western medical approach has been too cautious, too slow, and too late. When seniors get cancer, doctors throw the entire pharmaceutical arsenal at them: chemo, radiation, surgery, while missing the most basic protective nutrient. Vitamin D also interacts directly with tumor suppressor genes. That's not some fringe theory. It's backed by oncology research at the University of California, where studies show that vitamin D helps activate p53, a critical gene that helps suppress cancerous changes in DNA. If your vitamin D is low, your DNA is less protected. Imagine going through your senior years, already at risk from aging cells, and then being told your vitamin D levels are fine at 28 ng/mL, when what you really need is 50 or 60 to get full anti-cancer effects. That's the reality for millions of Americans right now. Ask yourself, when was the last time your doctor even mentioned vitamin D at your annual checkup? How many seniors in the United States are being tested? And when they are tested, how many are actually given therapeutic doses? Doctors in the United Kingdom are starting to prescribe 50,000 IU capsules weekly to deficient patients. Integrative practitioners in Canada and Australia often recommend daily doses between 2,000 and 10,000 IU, depending on blood levels, obesity, and health status. But in the United States, many doctors still hesitate, clinging to outdated concerns about toxicity. Yes, vitamin D toxicity can happen, but only at extremely high doses over long periods, usually when paired with high calcium intake. It's rare. The far greater danger is deficiency. It's estimated that up to 70% of seniors in the United States are deficient in vitamin D, and the rates are even worse among African American and Hispanic populations due to melanin-reducing vitamin D synthesis. This isn't a small issue. It's a public health crisis. Because cancer doesn't strike overnight. It develops over years. If you're low in vitamin D today, your body is less equipped to stop a cancerous cell from becoming a tumor tomorrow. Vitamin D affects over 2,000 genes. It influences immune response, inflammation, hormonal balance, all factors that determine whether cancer grows or gets destroyed before it can even start. In one groundbreaking study from the United States, researchers tracked women over a 4-year period and found that those who maintained optimal vitamin D levels had a 77% reduced risk of developing any form of cancer. That number is almost impossible to believe until you understand how vitamin D works on a cellular level. It's not a drug. It doesn't act like chemo or immunotherapy. It supports your own body's natural defenses. Your immune system is your first line of protection, and vitamin D strengthens the innate immune response by activating macrophages and natural killer cells that destroy abnormal cells. Yet despite all this, Medicare doesn't cover routine vitamin D screening for healthy seniors unless there's a documented disease that requires it. In Canada, many provincial health systems also don't offer free vitamin D testing unless you've already developed osteoporosis or a related disorder. This backward approach leaves millions in the dark, literally and figuratively, and it's enraging. Seniors in the United States spend tens of thousands of dollars on medications every year, many of which are prescribed for diseases that could have been prevented with nutrient sufficiency. It's not just about sunlight, it's about absorption. Seniors often have reduced stomach acid, making it harder to absorb fat-soluble vitamins. Some are on medications like statins or antacids that reduce absorption even further. If you're over 65 and living in the United States, and especially if you're indoors most of the time, there's a strong chance your vitamin D level is too low to offer real protection. And unless you're supplementing, eating fatty fish 3 times a week, and getting midday sun for 20-30 minutes, your body is starving for this nutrient. Doctors in functional medicine, especially in the United States and Canada, are starting to say that vitamin D is not just a vitamin, it acts more like a hormone. It regulates gene expression, it balances calcium and phosphorus, it modulates inflammation. It is critical for seniors who want to reduce cancer risk, improve bone density, boost mood, and enhance immune resilience. Seniors in assisted living. Facilities across the United Kingdom and Australia are often found to have dangerously low levels, partly due to being kept indoors and given bland, nutrient-poor diets. If you've been told that vitamin D isn't a priority, you've been misled. This is not about trendy supplements. This is about your body's ability to fight off one of the most terrifying diseases that can hit in old age. Vitamin D deficiency has been associated not just with higher rates of cancer, but with worse outcomes once cancer is diagnosed. In a study of prostate cancer patients in the United States, those with higher vitamin D levels had significantly longer survival rates and slower disease progression. The same trend has been seen in breast cancer, pancreatic cancer, and even aggressive glioblastomas. How long are we going to keep ignoring this? How many more seniors in the United States, the United Kingdom, Canada, and Australia have to suffer and die from preventable cancers before vitamin D becomes a frontline public health priority? Why isn't every senior being offered high-dose vitamin D supplementation by default, especially during winter months when sunlight exposure drops to near zero? Would you feel safe knowing you're walking around with your cancer protection system shut down just because your blood levels are too low? Are your parents, your grandparents, your older neighbors even aware of this? Most seniors still don't understand that vitamin D works before cancer appears. Once cancer takes hold, the battle becomes infinitely harder. Prevention is the real power here. Vitamin D isn't just critical for reducing the risk of cancer. It directly impacts how fast a tumor can grow, how effectively your immune system detects that tumor, and how inflammation is managed throughout the entire body. That's not a claim. That's the reality backed by decades of peer-reviewed medical data. In the United States, the National Cancer Institute has published multiple studies showing that vitamin D can help regulate angiogenesis. That's the process tumors use to build their own blood supply. Without new blood vessels feeding it, a tumor starves. But if vitamin D is low, cancer cells gain ground. This is why more researchers are pushing to classify vitamin D as a cancer-modulating agent, not just a general health nutrient. In Australia, elderly patients in long-term care homes have been shown to have better cancer recovery rates and even better chemotherapy tolerance when they supplement with high-dose vitamin D. It's not a magic bullet, it's immune support. Vitamin D reduces inflammatory cytokines that feed cancer and increases production of protective compounds like interleukin-10. It protects DNA from mutations caused by oxidative stress, and that's the starting point for most cancers in seniors. Years of toxic buildup from processed foods, environmental chemicals, medications, and stress all create DNA damage. Vitamin D helps repair that. There's also evidence that it's not just about the vitamin D level. It's also about how long you've maintained that level. In a US study published in 2022, seniors who had consistent levels above 50 ng/mL for more than 5 years had far lower risks of developing invasive cancers than those who had spikes and drops. That means if you're just now starting, you need to maintain those levels steadily. A single high dose won't fix years of deficiency. This is a daily, consistent need. Seniors with darker skin in the United States and United Kingdom are at even higher risk. Melanin blocks UVB rays that create vitamin D in the skin, so African American and South Asian populations often require 2 to 3 times more sun exposure to produce the same amount of vitamin D. But when you combine that with staying indoors, wearing sunscreen, or living in northern cities like New York, Toronto, or London, deficiency becomes nearly guaranteed. This is why some public health researchers are calling for mandatory supplementation programs for seniors in vulnerable demographics. Aging itself already puts the immune system into a weaker state, known as immunosenescence. That's where the body doesn't react as strongly to new threats, and inflammation becomes chronic and systemic. Vitamin D has been shown to reverse some of that immune aging, helping the body respond faster to abnormal cells and infections. A senior in Chicago, 78 years old, dealing with prostate enlargement and high PSA levels, started taking 10,000 IU of D3 daily with regular testing and supervision. Within months, inflammation markers dropped, PSA stabilized, and his energy returned. He had no idea how low his vitamin D had been, and no one had ever checked it until he saw an integrative specialist. Even in cancer treatment, vitamin D is becoming impossible to ignore. Clinical oncologists in Canada are beginning to track serum D levels during chemotherapy. Why? Because patients with optimal D status show less fatigue, fewer side effects, and better immune recovery. Vitamin D helps regulate insulin too, and insulin resistance is directly tied to cancers of the breast, colon, and pancreas. That means vitamin D helps protect through multiple channels, not just immune defense. It supports mitochondrial function, and mitochondria are where your cells decide whether to stay alive or die. Healthy mitochondria mean healthy cell death when things go wrong. But despite all this, US seniors still aren't told the truth. They are told to take 400 IU per day, a dose so low it does almost nothing. That recommendation came decades ago, based only on bone health, not cancer prevention. It's outdated and frankly dangerous. Modern research shows that 5,000 IU per day is safe and often necessary for seniors who are deficient or overweight, and yet it's still not recommended by mainstream healthcare providers. The excuse? We need more data. But how much more data is needed when over 20,000 studies already confirm the essential roles of vitamin D in preventing and managing diseases that kill the majority of seniors? In the United Kingdom, groups like the British Nutrition Foundation have started issuing warnings about widespread deficiency, especially in older adults living in care facilities or dealing with mobility issues. These seniors aren't getting outside, they aren't eating nutrient-dense food, and they aren't being tested. In some Canadian provinces, it's even worse. Nursing homes are not required to test or supplement unless there is an existing bone disease or severe malnutrition. How is this acceptable when cancer kills tens of thousands of seniors every year, and we know that something this simple could lower the risk? Vitamin D also works alongside magnesium and vitamin K2, and those are often deficient in seniors too. Magnesium is needed for vitamin D activation in the liver and kidneys, and K2 ensures that calcium goes into the bones instead of the arteries, which is especially critical when taking higher doses of D3. If you're supplementing with D3, make sure you're also getting at least 100 to 200 mcg of vitamin K2, as MK7, and a high absorption form of magnesium like glycinate or citrate. Without these cofactors, the benefits of D3 might not reach their full potential, and calcium might end up in the wrong places. In Australia, researchers have begun linking vitamin D deficiency with aggressive forms of melanoma, even though the country has one of the highest skin cancer awareness campaigns in the world. Seniors who avoid the sun completely end up with worse immune surveillance, meaning their bodies are less able to catch cancer cells early. It's a paradox, avoiding the sun to reduce one type of cancer while increasing risk for several others. That's why experts now say moderate, safe sun exposure plus supplementation is the best strategy, especially for older adults. There's even data now showing that vitamin D affects the microbiome, the trillions of bacteria in your gut that regulate digestion, immune response, and inflammation. Dysbiosis, or imbalance of gut bacteria, is linked to colon cancer and other diseases of aging. Vitamin D helps maintain gut barrier integrity and reduces systemic inflammation, which is crucial because most cancers thrive in an inflamed body. Imagine the difference it could make if every senior in the United States had their D levels tested annually and was given high-dose supplements if they were below 50. Imagine the healthcare savings, the lives extended, the suffering avoided. One study from a U.S. integrative oncology clinic showed that just correcting vitamin D deficiency in older adults reduced hospital visits, infections, and inflammation markers. Yet these protocols are not used in most hospitals. Why? Because there's no big profit in vitamin D. It's cheap. It's not patentable. Seniors are often told to just watch and wait when early signs of cancer show up. They're not told to check their nutrient levels. They're not told how to strengthen their natural defenses. They're handed prescriptions, referrals, and appointments. But what about prevention? What about giving the body the one thing it's been deprived of for decades? Every adult over 60 in the United States, United Kingdom, Canada, and Australia should know that vitamin D is not optional. It is not just a supplement. It is an essential component of disease prevention and cellular health, especially when it comes to stopping cancer before it starts.